Really simple things can cause yeast infection. So we see them sometimes. People say, I was on an antibiotic for a UTI or for bronchitis or whatever it was, and I got a yeast infection. That's a really common trigger. Other things that people don't think about is, in the summertime where I was on a lake all day long, sitting in my bathing suit that was soaking wet, or I went to the gym and I wore my yoga pants, and then I went grocery shopping and picked up my kids, and I was in my sweaty clothes all of the time. I always tell people yeast really likes dark, moist environments, right? The vagina is perfect for yeast to grow. So you kind of need to air it out. So switch in, wear your leggings to the gym, right? Do your sweaty thing and then get out of them, get into something dry, get into something loose fitting. I always tell my ladies, like at nighttime, sleep aired out, loose fitting shorts or night dress or something so that the vagina can breathe. Not an organ, but you can breathe. But so those are the big things. Other things that can help, like taking a daily probiotic, eating your Activia yogurt every day can really help prevent yeast infections. It's also important to really get an exam, get cultures done. I see people all of the time where they're like, I called my primary care, I got diflucan, and it's not going away, and it's not going away, and it's not going away. And you're like, please come in so I can do an exam. And you find out you don't have yeast. You have all of these other things. You really have a different infection or no infection, and you're treating just something that you feel like is a yeast infection. The more people treat things without really having a diagnosis, then they just really throw their environment off. The vagina it's an environment filled with bacteria. Everything should kind of live in harmony, and so the more medicines and things you take without really knowing why or what you're treating, things just get really thrown off. And so I think starting with an exam so that you're not just continuing to take medication, and then just kind of those lifestyle things to help.